Good day to all of you, to all the distinguished guests and speakers and the various distinguished attendees, ladies and gentlemen. My name is Alex Siow. I am a professor at the National University of Singapore, a position which I held for the last 7 years. And prior to this, I was actually a practitioner from the industry, and so I actually carry the title of practice professor. Now, I started my career as a civil engineer and progressed into IT. In 1989, I was the first person in Singapore to carry the title of Chief Information Officer. We started the IT revolution that we have today. So I am also the director of the Center for Health Informatics, and I have been and currently still is a board member of a community hospital in Singapore, and that gives me insights into the healthcare sector for the last 7 years. And today I want to share with you a topic about use of data science, AI, ML in the healthcare industry perspective. Let me share my screen. So as you can see, the title is Data Science and AI and Machine Learning in Healthcare and Medtech and Industry Perspective. Now, we all know that AI has been around for many years, even before I was born. And it has gone through a lot of transition. So actually, basically, I divide them into 3 stages: the birth of AI, and focus on specific intelligence, and focus on specific problems. So in the middle block, we know that AI went to a boom back in the 70s, and then it had the first AI winter, where because of limited applicability leads to funding pullback. So there was sort of a decline in 1980. And then there was an expert system that emerged. In fact, I was actually using such a system back in Singapore, back in the late 80s, early 90s. So it led to the second AI boom. All right. But then we encountered in 1993 a second AI winter, where there's disappointing results from the early usage and application, and so was also the collapse of dedicated hardware vendors. Right, so that second winter then led to a slow but steadily increasing AI boom, starting from 1993, slowly onwards until today, where we have increase in computational power. Big data led to better data analytic capabilities, improved algorithm, and many applicable use cases. And we know key trends enabling growth of AI, and AI has been around for many decades, but we have only recently brought enough of computation power and data to this form of AI to make it work really well. So you can see from this chart, we have the computing power, big data and analytics, advanced algorithm, and quite a number of use cases that actually promoted the growth of AI. And artificial intelligence is increasingly driving developments in technology and business, from autonomous vehicles to medical diagnosis to advanced manufacturing. These innovative applications are increasingly important and becoming more prevalent in society. And the commonalities of all this is the complex challenges with lots of data. Speed and consistency, also very important. and resistance from existing workers. Change management is very important in the application of AI. But ultimately, people are afraid that all this machinery will remove their employment and opportunities. So I don't know. I think eventually all this will be so common. We don't really consider them as artificial intelligence. It's just embedded within our economic system. Now, turning our attention to healthcare. So the current landscape for healthcare innovation. Yeah, I will divide them into two parts. First, a digital transformation within healthcare institutions. And here within this box, we have the primary hospital care focus, multiple programs with respective hospitals. And so we also, in Singapore, we have a Center for Healthcare Innovations that explore innovation and applying new technology into healthcare. And there are also plenty of innovative startup trials and also partnership with the hospital. So I consider this as a digitalization of the healthcare system. Then, of course, there is what we call digital disruption that happens to every businesses, and therefore healthcare is not exempt. So many health tech and medtech startups, alliances, and ecosystem have been coming on board. But of course, it's still in the early stages, so we have not really recognized a winner, so we don't know which is the trusted one. So there are telehealth programs coming aboard in various countries, and you know, things like Babylon, also in the Ping An Good Doctor in this part of the world, in Singapore. And consumerization of healthcare is what I call this part here, right? I don't know whether you are familiar with this iron triangle of healthcare, where actually the priorities, the top system priorities are costs, quality, and access, and all this must be so well balanced. The concept was that these priorities could not be improved simultaneously. One cannot improve one priority without negatively affecting another priority. So if you want to increase or reduce costs, then quality will have to be increased, and access also has to be increased. Okay, just take a look at the next diagram. Yeah. However, with the advent of digital innovation, this will disrupt the iron triangle. So healthcare access and quality will rise and costs will decrease. So the iron triangle of healthcare does not really apply nowadays because of technology. And what are the growth drivers of AI in healthcare? Firstly, we know there's a lot of aging population, especially here in my country, and also in various parts of Europe, and also maybe in America. We have a larger geriatric population, and there's an imbalance between health workforce and patients. And increasing global healthcare expenditure, healthcare is getting expensive, but there is also a continuous shortage of nursing technician staff. So AI is and will help medical practitioners efficiently achieve their tasks with minimal human intervention, which is a critical factor in meeting increasing patient demand. From this diagram, you can see here, let me go back. That's the aging population. And the number of, there's a global shortage of healthcare professionals who reach 13 million from 7 million today. Okay. over 1/3 of countries suffering from this shortage are emerging markets. And looking at my region, right, in Asia, Southeast Asia, you can see the number of doctors per 1,000 people. Okay, Singapore is actually one of the highest, 2.3, and you have China 1.8, and some is 0.4 in Indonesia. And internet penetration, okay, is highest also in Singapore, and healthcare expenditure is also, of course, the highest in Singapore. Yeah, so they're all in one way or another correlated. The availability of technology and the availability of trained personnel, and leading to better healthcare for the people. So application of AI has gone through a lot of transformation from the iron triangle of healthcare, where you balance quality, access, and cost, into introduction of AI, and what we call A is the AI. The AI improve accuracy, consistency, and efficiency, where AI actually improve access, effectiveness, and affordability. Okay, so things that are coming up will be digital consultation, radiology, and images, also introduction of robotics, clinical and pharmaceutical trials. Let's take a look at digital consultation, and I call this AI triage. So what AI can do is not actually to replace the doctor. So doctor need not be afraid that they will be replaced. What we do is to augment the capabilities and the efficiency of the doctor by allowing the AI to actually carry out triage, so preliminary diagnosis, so that the doctor can be freed up, to look at the patient after he received the initial sort of diagnosis from the AI. Okay, so but then in order for the AI to be able to carry out the task, the AI requires a lot of data, right? And it requires training. It has to be trained by doctors. So machine language and natural language processing has helped to move beyond checklists and templates into intelligence. So maybe this diagram can show a bit better when the user come in. They have complaints, they have some pain, and actually they go through triage. All right. I can see on the right side, we have the AI doctor. All right. So not strictly a doctor, but the AI here, and carrying out the triage based on the database they have, and then they have the history taking of the patient and have a simple diagnosis, and the doctor that's attendant to this patient, okay, will actually then review and take the diagnosis with the suggestion based on AI analytics and make the prescription, all right, which is recommended by AI. But of course, the doctors still have the last say. In radiology and images, considerable time is spent on reading and analyzing X-rays, CT scans, MRIs, ultrasound, comparing several 3D scans to understand what has changed since the last scan is time-consuming and sometimes erroneous. Right. However, with AI algorithms, it is possible to eliminate such hassles and discover the changes almost in real time. Computer vision technology and deep learning enable systems to read, learn, interpret, learn again, support complex image recognition tasks to recognize complex patterns in imaging data and providing quantitative assessment results of radiographic characteristics. and application to mammogram X-ray analysis. So the issue is experienced radiologists need to examine large number of X-ray, repetitive and time-consuming. Accuracy from X-ray alone is limited, and radiologists tend to recall patients for retests and biopsies. So there's this increased cost, increased patient stress. By application of AI, the result is the AI system had data for 170,000 examinations, 36,000 cancer-proven X-rays, and we have the profile of the patients stretching various countries, and we have determined that human radiologists alone, the results of correctly diagnosing a problem is 75.3. If just AI alone is 88.8%. But combining these two, which we ought to, right? Because sometimes we still need the human judgment at the end. So AI plus human will average out to 84.8. It's still a very good percentage of accuracy. Then you don't have to actually, as we mentioned earlier, to recall patients for retest. For 84.8% of the cases, we are quite sure what is the diagnosis. Robotics, the human brain contains tens of thousands of neurons, making brain surgery a life-threatening prospect for patients. Robots mitigate the risks, letting surgeons perform fast and accurate keyhole surgery using multimodal imaging, precision optical recognition, and surgical positioning and guidance. So hospitals in China, for example, use robots to help with the guidance and the positioning of craniotomy openings to remove cysts when treating epilepsy. So the improved accuracy means that the openings can be smaller, which also reduce the probability of there are complications. And the next thing is clinical pharmaceutical trials. And trial error is common in pharma research. To find target molecules, they spend many, many years. So ROI for top 12 pharma only 3.2% despite expensive new drugs. That's according to a Deloitte study in 2018. Cloud-based supercomputing and AI algorithms significantly reduce the amount of trial and error required for candidate drugs once a drug target is confirmed. So with AI systems trained with massive amounts of data and intelligent devices, trial times can be greatly reduced and success rates with significant increase. So AI in pharmaceutical research can reduce R&D costs by 60% and shorten R&D times from 3 years to 1 year. Bringing down R&D costs can help stabilize and reduce the final prices of pharmaceuticals, improving overall affordability. Now, I have chosen to speak about healthcare and also at a time when healthcare is on everybody's mind, right? Because of this global pandemic. So AI has been involved in the fight against COVID-19 as I have selected several newspaper and articles. For example, tapping AI to battle COVID-19, and Chinese supercomputer uses artificial intelligence to diagnose patients with chest scans. And for example, chatbots provide millions of COVID-19 information every day. All right, these are what the whole community has been helping to fight against COVID. And we scientists, we will have to use whatever we know, and which is our technology. And those of us who are in machine learning and AI, we can also contribute towards fighting this pandemic. So potential challenges of AI in healthcare, firstly, development costs. It costs a lot to develop and using expensive hardware and software. And there are ethical issues. There are reluctance among medical practitioners to adopt AI. I think it stands to reason that some doctors may think that they don't really trust the machines. I think they can make better judgments. And of course, the fear that machinery will replace humans. There's also the integration issues, the lack of interoperability between AI solutions. There are many from all over the world. We have new AI solutions, but how do these systems interoperate? And how do AI solutions fit into the existing workflows that we have? And there are data issues. There's a need for continuous training by data from clinical studies. The more data we have, the better will be our accuracy. Incentives for sharing data on the system for further development and improvement of the system. And of course, the whole world is also now in the developing and developed countries. We have data privacy concerns. And that's also a big challenge in Singapore, where we have many laws to guard the data privacy of private citizens. And there are regulatory issues, competing priorities in traditional healthcare or electronic health records, portals, meaningful use of data, and as well as there's a budget constraint. And finally, a human touch. How will we interact with AI, and how to balance with the human compassion in healthcare? Is it strictly all machine decision, or we still have to add the human touch? And in cases where the AI detect some serious illness, the AI do not have the compassion and the human touch, and that can only be done by the healthcare practitioner, which is the doctor. So with that, I thank you. I have given you a perspective of the healthcare industry from a practitioner's perspective, and also thrown some challenges to all of you who are here, who are involved in AI, data science, and machine learning, to continue to hone your research and help in improving the healthcare sector. Thank you very much.